to the American Red Cross, 5 million patients in the U.S. are in need of blood transfusions every year. Only less than 38% of the population is able to give blood, and out of that 38%, only 10% actually does. That is such a small amount for all the people who are in need of blood donations. My name is Alejandra, and I will be giving you a speech on how blood donation process works. For those who have never donated blood or know about the process of donating blood, I hope to introduce it to you. As for those who have donated blood before, I will be explaining some of the more in-depth concepts and the steps that are taken to make sure the blood is okay for other patients. I have always wanted to donate blood since I was young. The age to start donating is 17, but I was only able to donate blood earlier this summer. I had a lot of fun, and after, I had a great sense of satisfaction. However, I know there are a lot of people who don't enjoy it, especially because of needles. Today, I will be speaking about the basics of blood donations, the process, and what happens behind the scenes of the blood that is donated. We will begin with the first step, blood donation basics. According to the Red Cross, an adult has an average of 10 pints of blood, and only 1 pint is donated during each process of donation. Red blood cells, which make up 45% of blood, are the ones that carry oxygen. It is used to treat anemia. Platelets and white blood cells only make up less than 1% of blood, and they play a role in controlling bleeding. The most common use for this, the third one, is plasma, and that makes up 55%. The most common use for plasma is to keep the blood from clotting. These are the 3 concepts of blood. Each person has a different blood type, and there are a total of 8 blood types. The first one is A, followed by B, then AB, and O. Here we have an example of all the blood types we have. As you can see, O is the universal blood donor because it is able to give it to everyone. And if you see down here, AB positive is able to receive from every one of the blood types. That is called the universal blood receiver. There are only 7% of the U.S. population who is O negative. As for the AB positive, it is one of the rarest blood types to find. The next stage is the donation process. It begins when you register. When you first go in to donate blood, they give you a questionnaire to fill out. Some of the questions are related to travel. Where have you gone to in the recent days, recent months? Can affect your blood. Also, they ask if you have been exposed to any diseases. They will also provide you with a pamphlet that explains the blood donating process. They ask that you bring a photo ID or your donor card with you. After completing the registration, you will begin the donating process. It usually takes about 10 to 20 minutes to complete the donating process. They begin by finding a good vein on your arm, whichever one you feel more comfortable with. And then they sterilize the area and open a new sterile needle and begin the process. If you're afraid of needles, the American Red Cross says that it feels only like a small quick pinch and it is over in seconds, so no need to worry. They also fill up test tubes so that the blood can be tested and so you can make sure that the blood is safe for other patients. When the donation process is complete, they advise you to sit there for 10 to 15 minutes so your body can get used to the loss of the 1 pint of blood. And they also offer you water and a quick snack so your body can get used to it. So enjoy. The last is what happens behind the scenes or after the blood has been donated. What happens to all that blood? It is sent to different lab centers to be tested and to be processed. According to the Blood Centers of the Pacific website, the first successful human transfusion was accomplished in 1880. That has been such a long time, and now it's a lot safer to donate blood. One of the recent changes, like I said, was testing. Every pint of blood that is donated in the American Red Cross undergoes testing. It is checked for what type of blood it is, either A, B, AB, or O, and if it's positive or negative. Also, they check if it has any diseases, for example, hepatitis. If it is positive for any of the diseases, it is tossed. You can't infect a patient with a different disease. That is why only 38% of the population is able to donate blood. After the blood is tested, it is then stored. The first part of the blood that is stored is the red blood cells, and that can be stored in 6 degrees Celsius, and it can be stored for up to 42 days. Platelets are the second things that are stored, and they are usually stored at room temperature. And they only last 5 days. The last is plasma, and they are just placed in normal freezers. They have the longest shelf life, up to 1 year. Finally, the Red Cross has to distribute all of the blood. They are constantly supplying hospitals and trauma places like such. Blood is needed for accident victims, for surgery, and for people suffering from certain diseases like cancer. And it is also used for many medical researches. To conclude, in this speech, I have talked to you about the basic blood donation process, what happens behind the scenes, and all that has to do with blood. There are 8 different blood types, like I said, A, B, AB, and O, and those have negative or positives. There are 3 main steps in the donation process: registration, donating the blood, and refreshments. Then it is taken behind the scenes. It is stored and distributed. Just remember this: blood cannot be manufactured. So for now, we rely only on donors and on each other when blood is needed. There are only a few people who can donate blood, so you might make a difference. Thank you.